Welcome to the New Dentist Study Club podcast. My name is Dr. Sanj Mohanta. We're going to learn about clinical management, practice management, and the emotional management of dentistry. Let's learn how to be happier in dentistry. Let's go. Hello, my friends. Thank you for joining me on another special podcast with my friend, Carla Cohn. She's a general dentist in Winnipeg, Manitoba, Canada, and she's going to teach us about pulpotomies on primary teeth and vital pulp therapy on primary teeth. And so by the end of this episode, you're going to be confident treating children because you'll know what to do if pulp starts to bleed. So thank you, Carla. Thanks for joining me. You're such a special friend, and I really appreciate you being on this podcast.
Oh, thank you for having me. Likewise to you. You're a very special friend, and we
Uh,
have a nice bond and a nice friendship and a nice collegiality. And I'm honored to be on
yeah.
your podcast.
Oh, thank you, Carla. I'm honored that you're here. So please tell the audience more about yourself.
Yeah, so I've been practicing dentistry for more than 3 decades, hard to believe. And I just see kids. So I'm a general dentist, but I devoted my practice just to seeing kids. And I've been doing that my entire career. In the last few years, I'm now just limited to the operating room practice. So I only take care of the kids that need to go to the operating room now. So that's been an amazing journey in the last few years, too. I do a lot of teaching, I do a lot of speaking, a lot of hands-on workshops, get invited around North America and a bit abroad. So that's also a fun part of my career as well. And it's been a ride. It's been a great journey on this dental rocket ship that we're on. So it's been a lot of fun, and I'm happy to be able to share with you and all of your people about pulpal therapy, because that's something that's changed a lot in the last while in
Yes.
pediatric dentistry. Yeah.
Well, thank you, Carla. It's been a ride watching your career evolve. And thank you for
Yeah.
sharing all of your expertise and skills with us. And stay for the audience, stay tuned to the end of the episode because Carla's going to talk to you about her upcoming courses, how to register for them. And also, she's on Instagram at Kids Dentist Carla. You have to follow her. She has great videos on how to do the technical aspects of pediatric dentistry, and she's a general dentist like the most of us. So if she
Yeah,
could do it, we can do it. Carla has
absolutely.
taught me a lot about pediatric dentistry, so I'm so excited that she'll be able to share with all of you.
Oh, thank you. Thank
So
you.
I think this is a very important topic because a lot
It
of
is.
general dentists know how to do the dentistry, but they get so scared of seeing kids for restorations because they think, okay, what if I hit the pulp?
Yep.
Now what do I do?
Yeah.
So
Yeah.
tell us,
Yeah.
can
It's
we So first, so tell us, for example, can we do direct pulp capping on primary teeth?
Yeah, I mean, let's talk all about all of it. I mean, what you say is
Okay.
very true. You do a lot of
Yes.
stuff that is
Yes.
way more technically difficult than seeing kids.
Yes.
And it's that you don't necessarily, as a general dentist, see a lot of kids. You don't
Hmm.
leave dental school with a lot of confidence because you haven't done a lot of these procedures frequently, and it's just going to get more and more challenging, as we were talking about off camera.
Hmm.
And then of course there's the behavior aspect of the kid
Yes.
that's always a challenge. So the short answer, can we do a direct pulp cap on a
Hmm.
primary tooth? The short answer is with caution. There's a
Okay.
lot longer answers and so many different things that we can do in vital pulp therapy, which is where what we're going to talk about for the next while that we're together. So
Yeah.
you have options. You
Okay.
you have material options, technique options, all kinds of different options.
Okay.
So where do you want to
Okay. So
start?
let's start. Like, say we get that pinpoint pulp exposure
Yeah.
on the primary molar. What should we do?
Yeah.
Or
So
any primary tooth?
any private tooth. So the literature and the evidence has been telling us up until really recently that direct pulp caps, you get that pinpoint exposure, are not a good plan. Yeah,
Hmm.
that's the previous evidence. As our materials are evolving
Mm.
and we have better things than putting calcium hydroxide onto an
Yes.
exposure. The success rates are getting better. So now
Yeah.
evidence is starting to shift. It's still, when you look at that whole review, the meta-analysis, and I go back to, there's a 2024 review that was done on vital pulp therapy that tells us basically what we should do, what we shouldn't do, what we should do with caution.
Hmm.
If you're gonna do a direct pulp cap on a primary tooth, it's with caution.
Okay.
The whole scenario needs to be right. The pulp needs to stop bleeding, of course. Your exposure needs to be small. You need to use an MTA or an MTA-like material. If you're gonna
Okay.
do it, that's what you have to do it on. And if I was gonna choose in my clinical practice, if I had a patient that I had a pinpoint exposure on and I was gonna try a direct pulp cap, I'm gonna choose that patient, I want to say wisely, so a
Mm.
kid that I haven't got 10 years of lifespan of this tooth for this to last for. So I'm going to choose a patient where that tooth is closer to exfoliation than not.
Hmm.
Or then also in a scenario where maybe I've got a kid in the chair and we get that exposure, the kid's not really terribly cooperative to begin with. Are they going to
Mm.
be able to sit through the whole pulpotomy? Maybe that's another time I would choose to do a pinpoint exposure direct pulp cap. And also, you need to look at the whole thing at the diagnosis. Is the tooth symptomatic? Is the
Hmm.
exposure from a mechanical exposure? Or is it from a carious exposure?
Mm.
Because our carious exposure, we're going to have lower success rate. We've already got bacteria in there.
Yes.
You've got bacteria in there. A mechanical exposure, maybe you might have a little bit better success rate because there's not as much opportunity for that bacteria to have penetrated. So
Good.
pick and choose your pinpoint exposures carefully and then monitor them closely too. Well, bring
Okay.
the child back and monitor it. So
So
yeah.
if you are going to do a direct pulp cap on a primary tooth, what are you going to use to stop the bleeding?
So I'm stopping my bleeding with pressure, and
Okay.
I'll take a saline soaked pellet. You can also take a dilute sodium hypochlorite soaked pellet
Okay.
and stop it with pressure. That's
Okay.
all I'm stopping it with. I don't want to have any kind of hemostatic agent next to the
Hmm.
pulp. I don't want any ferric sulfate. I don't want any hemodent, astringent, none of those,
Okay.
because if that's going to seep in, and it will, then you're going to have chances of internal resorption, which
Hmm.
of course is not a good scenario.
Okay. Good.
Yeah.
And then what are you going to cap it with? You said MTA or
And
a
MTA,
similar.
yeah.
What's your favorite MTA?
And we got all kinds of products now that have calcium silicates in it.
Yes.
So you got choices. If you use Theracal LC, so that's a Bisco if we're in Canada, and I think most of your audience is Canadian. So
Yes.
if Bisco in Canada is distributed by, they're called Curion now. So
Yes.
Theracal LC is a resin modified calcium silicate. So it's got the calcium silicate in it. It's in a syringe. You squeeze it out onto your exposed area and you can light cure it. You can carry on with your procedure. So it's a great, easy product to use. You can also use it as a liner. If we don't have an exposure, you can use it as an
Mm.
indirect pulp therapy. So that's one thing that we
Okay.
can use. You can use biodentine, which is
Okay.
a calcium silicate, dicalcium silicate, but that's a self-cure. It's a cure that's going
Okay.
to take about 12 minutes to cure.
Oh, wow.
So, you can put it on and then we could put something like a glass ionomer on top of it and let it cure underneath there.
Okay.
But we do need to wait for it to set to some
Okay.
degree. If we're going to do anything more definitive than a glass ionomer, you got to wait for it to set. There's a newer material, which isn't really new. It's just rebranded, similar material to what it was, called Edge Endo Utopia. That's
Oh, okay.
from Henry Schein distributes it. And that's also an MTA, like calcium silicate like material. But again, that one also needs to cure, self-cure. So you have to have wait times. Then there's like the neo putties, the neo MTAs, or else a straight MTA of any type. So anything that's got MTA, calcium silicate, dicalcium silicate to it is going to be good for, if we're going to do a direct on a primary tooth, it has to be something with that as its, main ingredient.
Oh, great. That is excellent. So for direct pulp caps on primary teeth, just to summarize, with caution,
Yep.
pick an older child,
Yep.
maybe it's, or if it is a younger child, maybe if they're uncooperative, you don't think they can go through a full pulpotomy, then that might be your only option. Monitor
Yeah.
them. You're going to stop the bleeding with a cotton pellet and saline or diluted sodium hypochlorite, and
Yep.
then cover it with MTA or calcium silicate or calcium disilicate, for example, Neoputty or Theracal LC.
Yeah. You got it. That's it.
Good.
Awesome.
Now,
Great
do you have a
summary.
favorite? Yeah, thank you. Do you have a favorite product to use for indirect pulp caps? So we're getting close to the pulp. There's still some
Yeah.
infected dent in there.
Yeah. So indirect pulp therapy is actually going to give you your best success. So
Yes.
if we know when to stop drilling, or if we can stop drilling, then indirect pulp therapy is going to give us our best longevity, our best success rate, or at least chair time. And so you can use similar material. So any of the ones that I mentioned already,
Okay.
use that. But you can also use TheraBase. So TheraBase is
Mm,
another Curion Bisco product, but
okay.
this one is self-adhesive. So as
Oh,
an indirect, it's going to give you that advantage of that adhesion to the tooth structure. We don't want it to be on direct because it's self-adhesive. It's got an
mm,
acidic component to it. So
okay.
if we had that exposure, stay away from your TheraBase. But if you're
Okay.
indirect, it's a great product too. So any of the ones that we talked about for direct plus
Okay.
the TheraBase, or the thing that we don't talk about very much when we're talking about indirect pulp therapy, but it really is indirect pulp therapy, is when we use our silver diamine fluorides. And
Ah,
so we can treat the pulp indirectly by using a silver diamine fluoride and causing our mineralization to happen. And that has to be far enough away from the pulp for it
yes.
to be not to penetrate into
Okay.
the pulpal therapy, into the pulp chamber.
Do you
Yeah.
know how far away from the pulp the decay can be before we
Yeah.
put STF? Okay.
So that's the crystal ball question, right?
Yes.
How far do we have to be? You want to be like a couple millimeters away, but
Okay.
you need to be a couple millimeters of sound dentin away. And how do
Oh,
we really know if
yes.
because silver diamond fluoride is going to penetrate right through the
Yeah.
soft caries, like, hot knife through butter.
Yes.
And so it's got to be sound dentin. How do I know? I can't see. So
Yeah.
I'm estimating. I want to err on the side of caution. I don't want that silver fluoride to touch the pulp. So at least a couple millimeters.
Okay. That's good.
Uh,
So that was a very good, protocol for indirect pulp caps because a couple of years ago, the American Dental Association gave guidelines on how to restore teeth, primary and permanent, with moderate or deep caries. And they actually said, do not remove all the caries. Do
yeah.
selective caries removal, leave the
Yeah.
infected dentin close to the pulp, put your liner
Mhm.
or base, and then restore.
Yeah.
And you're right, that does give the best success, staying away
Yeah.
from the pulp.
It does. Yeah.
Okay, so what if we got a bigger pulp exposure? So now it's bleeding. Should
Yeah.
we do a partial pulpotomy or a full pulpotomy?
So I do full pulpotomies.
Okay.
I'll remove the entire coronal pulp and I'll treat it that way. And so
Mhm.
I go in, make a good wide access, take the roof of the chamber off, and take all of the coronal pulp off. In my opinion,
Good.
you've got bacteria in there that's going to give you, clinically, that gives me the
Mhm.
best success rate to do a full pulpotomy.
Okay, I
So
do the same. Now, do you use a high-speed burr and then switch to a large round burr, or do you use a high speed? Okay, so you do. So
yeah,
you do the same thing I do.
yeah, yeah. I do a high speed burr, usually a diamond. I'll remove the roof of my pulp chamber with that. And then
Okay.
once you can almost feel it's like feel the pop of the cap coming off of
Yes.
and then I'll go in with my big round. I'll go with a number 8 slow speed round burr, and I will get out the rest of the coronal pulp with that until I can see the radicular pulp stumps.
Good. Now, a common mistake that I used to make was not making the access big enough because I was used to
Yeah,
those smaller accesses with permanent teeth.
right,
But with
right.
primary teeth, the root canal orifices are quite wide, like
They
and
are.
far away from each other. So you are
Yeah,
making a really large access prep.
you are. You're making a really wide access prep so that you can, number one, get everything out of the coronal pulp
Mhm.
chamber. You can see and you can get your material down to where it goes. And if you think about it, like a lot of what you do for adult dentistry is you preserve tooth structure, preserve tooth structure.
Mhm.
Yeah, that's why am I preserving tooth structure? This tooth is going to be covered with
Yeah.
a crown,
Mhm.
most likely. And so I need to have that access. I need to see where it is that I'm going.
Okay, good.
Yeah.
Now, how do you stop the bleeding?
So same as with your direct pulp
Okay.
cap, I like to do a saline soaked cotton pellet. So
Mhm.
I'll take a whole bunch of saline soaked cotton pellets and I'll just basically pack that pulp coronal pulp chamber with them. So 6 pellets, 8 pellets, whatever fits.
Okay.
Create that pressure. You can also do sodium hypochlorite and do it, a dilute sodium hypochlorite and do it the same way. But the pressure, I keep it in there, I keep it packed in there while I'm fitting the crown.
Okay.
And it shouldn't take more than a minute for you to achieve some
Okay.
hemostasis that way.
Okay, good. So if there's a little bit of bleeding afterwards, is that okay after you remove that cotton pellet?
So it shouldn't be actively bleeding. So you
Okay.
shouldn't see it gushing out of the pulp stump. Now, this is the part that is, it was very clinical judgment, right?
Hmm.
You're not going to, we're used to doing, if you're used to doing pulp therapy with formicrosol or ferric sulfate, like in the old days,
Hmm.
you'd see blackened pulp stumps. You're stopping the
Yeah.
bleeding and you're not going to see that. So you're still going to
Hmm.
see some oozing. Actively bleeding means that you can't stop the bleeding. You're filling up your coronal pulp chamber with blood from the radicular pulps. That means that you've still got infected tissue, and
Okay.
so you've not done a job maybe of removing all of the coronal pulp tissue, or maybe it's a hyperemic tooth and it's
Mm.
not a candidate for vital pulp therapy.
Okay, good.
Yeah.
So yeah, good points, Carla, because you know, bef before we used to use ferric sulfate and
Yep.
formicrosol, and I just want to tell the audience, do not use those anymore.
Nope. Oh.
And you can just use like cotton pellet with nothing on it. Like
Yeah.
if you don't have saline readily available, and I
Yeah.
use a cotton roll and I make a
Yeah.
large cotton pellet,
Yeah.
and because it's such a large excess, and I
Yeah.
stuff that and
Yeah.
it stops bleeding really quickly. You don't need any medicaments.
No, no, that's not the
Mhm.
medicament
Mhm.
part, right? The
Yes,
medicament part is what
exactly.
you're going to put in next. And one thing I'd sort of caution people too, because like what you said is it's a great point. Not everybody has saline available. Not everybody
Yes.
has sodium hypochlorite available. And sometimes people take some local anesthetic and soak their pellets. Be
Oh,
careful, because if you're
yes.
putting local anesthetic in, you don't want to, get your maximum dosage of local anesthetic
Oh,
all through
yeah.
that, because that's going to absorb into their system. That's right
Exactly.
into their bloodstream. So with caution also.
Okay, good.
Yeah.
And then if it is still bleeding after a couple of minutes,
Yeah.
then just take your slow speed drill and drill a little bit more because maybe
Yeah.
there's some pulp left behind.
Exactly. Exactly. So I'll go in and I'll drill a little bit more, try and get more tissue out, try and achieve hemostasis again. And if it doesn't
Okay.
happen after that time, I'm like, this tooth is hyperemic and it needs
Okay.
to it needs to go.
Okay. Good. So we stopped the bleeding with the cotton pellet. Now what are you gonna place inside the tooth?
So now I need the medicament, right?
Okay.
So I got to do again, any of the MTAs that I talked about, the Neo
Okay.
MTA, Neo Putty, MTA, the Edge Endo, the Utopia one, the Biodentine. Those are
Okay.
all great materials. Pack it in. I'll do 3 to 4 millimeters of depth of that. And
Okay.
then I don't bother waiting for it to set because I'm cementing a crown over top of it. Now
Yes.
I know that's not everybody. So
Hmm.
the one material that you can use that you can carry on right away with is the Theracal PT. So this is like the
Okay.
Theracal family. So the Theracal
Yes.
PT is specifically for pulpotomies. So it's again resin modified calcium silicate. It's all got a dual cure to it, so that when we
Oh,
put it
good.
to that depth, we're not worried about getting the curing light down there because it's got the dual cure component.
Oh,
So you
excellent.
can put it in and then light cure and then carry on with your procedure. And if you're gonna do a composite, pick your composite material carefully. So composites on top of the standard of care on top of a pulpotomy is a crown. And I know
Yes.
just like general dentists don't
Mhm.
love doing pulpotomies because they're not familiar or they've done a lot of them. It's the same thing with crowns. They shy away from them. You do all of this wonderful work with these composites on adults in a nice dry field that
Yes.
is then the child, or sorry, the adult is going to be careful with it. The child's not. And so you get these failures because you can't isolate. They're not going to be careful. You're trying to make too big of a composite resin restoration. So standard of care, pulpotomy, and a crown.
Okay.
If you have to choose a composite, there's a recent study, I think it was 2024, that talks about micro leakage on pulpotomized teeth and then putting composite over top of it. And the one out of this study that won for the least
Yes.
micro leakage was the Pulp dent products, the Activa. So they did
Oh,
show the least micro
okay.
leakage. So if you have to put a composite over top of a pulpotomized tooth, do use the Activa.
Activa.
Yeah.
Okay. What's in Activa?
So Activa is the name brand of the composite resin, and it's not really a composite resin either. It's like I think it's a ionic resin modified glass ionomer. So it's got resin
Okay.
in it, it's got glass to it, but it behaves like a resin. It's got great
Okay.
longevity, and you place it like you would a resin. It's a little bit flowier,
Okay.
and so your anatomy, you're not gonna have the anatomy you would with a typical packable composite, but it's gonna
Okay.
go the distance in terms of micro leakage. It's got great flexure, and
Okay.
if you have to do it, use that one.
Okay, good.
Yeah.
So I just want to tell the audience something that Carla pointed out. There's a difference between Theracal LC, light cure, and Theracal PT, pulp therapy.
Yeah.
Theracal LC, you're going to use for your direct and indirect pulp caps that you can use
Yeah.
as a liner. But for Theracal PT, that's when you're going to use it after a full pulpotomy.
You got it.
Okay,
Awesome.
so should we
Perfect.
put something over top of the MTA or Theracal PT before we put, the crown or the composite?
I'll just cement over top of it. So I use a
Okay,
resin modified
good.
glass ionomer. Whatever is not filled in that chamber with my Theracal PT or my MTA like
Hmm.
material gets filled with the resin modified glass ionomer cement.
Okay, good.
Yeah.
Excellent.
Yeah.
And any tips on making on the crown? Because
Yeah.
some people are like, uh, are afraid to do a pulpotomy because they're like, well, I can't do the crown.
Yeah. I know. I know. And the crown is probably like the easiest
It
procedure.
is.
It really is. So, I'd say if you're not confident doing the crown, go to some courses and
Yes.
learn how to do them. Go to some hands-on courses, cut a couple crowns, find a mentor, somebody, maybe in your area that does a lot of crowns, and spend the day with them or spend an hour
Yeah.
with them and just watch and then practice, because
Yeah.
best time to do it is now, right?
And it's so much easier to do a stainless steel crown than it
Oh
is to
yeah.
do a real crown on a permanent tooth.
Oh,
So if you can do a
absolutely.
real crown, like this is you're gonna be like, oh my gosh, in 5 minutes I was able to do this.
Yeah. Yeah. Absolutely.
And I
Absolutely.
learned how to do crowns on my own.
Yeah.
So if I can learn it from a YouTube video, then
You
anyone
can
can learn
you
it.
can learn it. You can, yeah. They're
And
not hard to
just
do.
just pick I would say case selection is the most important when you're learning something new. Like
Of
I picked a
course.
9-year-old
Yep.
where it was the first primary molar. She only had another year with this tooth. She
Yep.
was well behaved. Her parents were cool. I thought if I screw up and I have to take out this tooth, I don't have to worry about a space maintainer.
Yep.
She's going to be cooperative for the extraction. The parents are going to understand. And that
Yeah.
was my first crown. And then I was like, okay, I
Yeah.
can do that. Built my confidence. Then I
Absolutely.
picked a slightly younger child next time, and
Yeah.
that's how you do it.
Yeah. Yeah. You gotta push the envelope to grow, right?
Hmm.
Otherwise, you're just gonna stay stagnant. So yeah, good for you.
Exactly. Oh, thank you. Okay, so my final question is, what if, you do the pulpotomy, you removed all the pulp tissue, but it's bleeding a lot.
Yeah.
It's a hyperemic pulp.
Yeah.
Do you extract or are you doing a pulpectomy?
Yeah. I 99% of the time I'm extracting the tooth.
Yeah, I'm the same.
Yeah. Occasionally we'll get, and I won't do this on a molar. So, I mean,
Okay.
like never say never.
Yes.
But I will never do a pulpectomy on a molar. I'm not set up for it. I'm not skilled
Mhm.
enough in it. And it's a very technique sensitive thing. You can see some beautiful work some people do,
Yes.
but it's a lot. For an anterior tooth, if I have a hyperemic tooth and the parents really don't want it extracted,
Mhm.
that's an easier procedure. Then I'll do a pulpectomy. But again, I mean, once in a like less than a blue moon, will I
Yeah,
do a
I'm the same
pulpectomy?
way.
Yeah, yeah,
So it is a good idea to, tell the parent if it is a large cavity, even if you don't expect to hit the pulp and you do,
yep,
to tell them right away, I'm going to try to do a root canal. It's not successful. We're going to have to change course and extract the tooth. Talk to them about the possibility if they need a space maintainer.
yep,
So, have that discussion with them before you proceed.
absolutely.
And now you have a backup plan. If it doesn't work, you can take a deep breath and realize, okay,
You
I
bet.
already talked to the parent about this. The child's already anesthetized. I can extract the tooth,
Yep.
and everyone's already prepared.
Yeah, that's a huge piece of advice for anything that we
Yes,
do for kids,
exactly.
and to have that conversation ahead of time too, because you never know
Yes.
where the behavior is going to go.
Yeah, it's true.
So yeah, so really good.
Well,
Yeah,
that's been
perfect.
fantastic, Carla. You gave a
Awesome.
lot of great tips. Thanks for also
Oh,
naming the materials that you like to use. I like
of
to use those
course.
as well.
Yeah,
They are
they're great
great
materials.
products. And like you said, like the materials have improved a lot. So our
They have.
techniques have to change as well.
They do. They
Mhm.
do. We
Yeah.
need to be open to learning new
Yeah.
things. Yeah,
Yeah.
perfect.
Yeah. So I'm sure the audience is going to see a lot more kids, be a lot more confident,
Awesome.
be ready for their next, pulp exposure or pulpotomy.
Yeah.
But Carla, I've learned so much about pediatric dentists from you, taking your hands-on courses, your lectures. Please tell the audience about some upcoming courses you have.
Yeah, so I've got a ton of stuff coming up in the next little while. I'm kind of all over North America in the next little while, but I have one of my own courses coming up in Mexico. I'm going to do Cancun,
Wow.
and it's an exclusive, highly rated, adults only resort. We're going to do November 15th to the 22nd in Cancun. And it's not just me, it's a whole week. And we're going to do some pedo, of course. And
Yes.
we're going to do some endodontics. So I know some of you might be familiar with Dr. Rodrigo Cunha. He's an
Oh, he's
endodontist.
fantastic. He's such a
Amazing.
great lecturer.
He
Yes.
is, and very dynamic and engaging and great material. So he's going to do a day on endo for the GP, and he and I together are going to do an endo pedo type of a vital pulp therapy. So kind of a lot of what we were touching
Oh,
on
good.
here, more in depth, and
Yes.
then my husband's going to do ergonomics for the dentist. So we got a whole week, 16 hours of credit units for AGD recognized,
16.
ADA recognized. So if you're interested, come and see me. My uh, continuing education platform is called Lit Smile Academy. So I have a website, litsmileacademy.com. The information is on there. You can send me an email, info@litsmileacademy.com, or I'm sure that they can probably get me through you too.
Yes. Check out
Yeah,
Carla on Instagram at Kids Dentist Carla and
awesome.
check out Lit Smile Academy, LIT Smile Academy. That course sounds fantastic. We're going to learn how to do endo on adults,
Yep.
pediatrics,
Yeah.
dentistry,
Yeah.
pediatric endodontics, and then
Yeah.
also like ergonomics is so important. So that is a
It is.
great combo.
Yeah. It'll be fun.
Oh,
It'll be a great
yeah, it
resort.
will be.
Yeah.
Well, this has been
Forward to
fun, Carla. So thank you so
Oh,
much for
thank you.
sharing your time.
Oh,
And I
it's
look
my
forward to
pleasure.
seeing you soon.
Me
So
too.
everyone, check out Carla on Instagram at Kids Dentist Carla. Get her to 10,000 followers. She's almost
Yeah,
there.
so close. Thanks,
So thank
Sam.
you to everyone who's listening and
Yeah.
stay tuned for the next episode. Bye, everyone.
Awesome. Bye-bye. Thank you.
Thank you for listening to the New Dentist Study Club podcast. Follow us on Spotify, Apple Podcasts, and YouTube, as well as our Instagram page at New Dentist Study Club. Check out our link in bio, and you can register to be a member and attend one of our live in-person events in Toronto. Thank you so much for listening. Please share this episode with your friends and stay tuned for our next episode.